This is JAPI, and welcome to JAPI Podcasts.
In partnership with Torrent Pharma, by the makers of Nebicard and Telsar Biso, where science meets care.
This is JAPI. I am Dr. Mangesh Tiwaskar, and welcome to this JAPI podcast of December 2025 issue, JAPI Volume 73, Issue 12. Friends, this issue of JAPI has really very interesting articles, including 10 original articles, 3 review articles, 1 point of view, 1 pictorial CME, and 4 letter of correspondences. Let us discuss few of them in brief to just give you the zest of what is there in this December issue 2025 of JAPI. The first original article is the knowledge, attitude and practices of the CAP of Indian healthcare professionals on the non-diarrheal dehydration in diabetes. Authors are Manoj Chawla and T. This study was planned with an aim to evaluate the knowledge, attitude, and practices of Indian healthcare professionals regarding the fluid, electrolytes, and energy, that is FEE management, in the diabetic patients during acute non-diarrheal illnesses. In the methods, you'll realize that an online 30-item questionnaire survey was administered to 525 cross-specialties healthcare providers across India. The study focused on identifying the clinical gaps and perceived role of slow-release carbohydrate and ready-to-drink formulations. And this survey concluded that there is a significant initial clinical inertia in the hydration assessment by the clinicians, despite of the fact that 90% people, they identify osmotic diuresis as a high risk for causing the diarrheal illnesses, and 75% recognized that SGLT2 inhibitors as a factor can be one of the contributing factors to cause acute dehydration in non-diarrheal illnesses. The study also tells you that only 45.6% people check hydration status regularly and report it. The study concludes that the standardized oral FEE, that is fluid, energy and electrolyte supplements, are usually the need of the hour, and in the innovative ready to drink preparations, the survey says that 84% of the healthcare providers believe that they could probably reduce down the recovery time if they administer this at the right time, and the average period for the recovery is around 4.5 days, and that is very essentially recommended by this study. The second original article looks at cardiac biomarkers versus Apache 2 for the sepsis prognostication. The authors are Shefali Meena and team. Now, this study was planned with an aim to compare the prognostic accuracy of ProBNP, CPK-MB, and troponin I against the traditional Apache 2 score in the septicemic patients. Methods: a case control study involving 126 participants, 63 sepsis cases versus 63 controls, and biomarkers and Apache 2 scores were evaluated on day 1 and day 3 of hospitalization. The conclusions from the study are all 3 biomarkers were markedly high in the patients, those who were having a fatal sepsis in comparison to survivors. However, ProBNP showed the strongest correlation in mortality, revealing that the Apache score and ProBNP can be combined together for assessment of the mortality. Crucially, the study concludes that the trend, that is rising or falling of the levels of these biomarkers over 72 hours, is more effective predictor of prognosis than one single baseline value. The third article, which is original, looks at lipid profiles and plaque burden in the statin-naive acute coronary syndrome patients. And the authors are Dr. M. Pariyaswamy and team. Now, this study looks at the lipid profile and plaque burden with the aim to investigate how conventional lipid parameters and extended markers like ApoB correlate with the coronary plaque burden in the patients with acute coronary syndrome. In this study, they looked at 81 statin-naive patients who were evaluated via coronary angiogram using the Gensini score and detailed lipid profile. Participants were followed for 28 days to monitor the major adverse cardiac events, that is MACE. The conclusions of the paper are that the ratio of total cholesterol to HDL, the ratio of around 0.35, and the ratio of LDL to HDL of 0.31, along with the ApoB levels, show the significant positive correlation with the plaque burden. Interestingly, LDL alone did not show significant association. The study concludes that ApoB is a superior and a practical alternative for identifying atherogenic risk in the clinical settings. The next original article is Etiology and Outcome of Non-Traumatic Altered Sensorium, and authors are Usharani, Budimuru, and T. The gist of this study is that they looked at the etiology and outcome of non-traumatic altered sensorium with an aim to analyze the clinical profile, underlying causes, and mortality outcomes of the patients presenting to you in the emergency room with non-traumatic impaired sensorium. The methods they followed is a prospective observational study of 126 patients with Glasgow Coma scale of less than 10. The diagnostic tools included neuroimaging, that is CT or MRI, in 82.5% of the cases, metabolic panels, and electrocardiogram. The study concludes that the etiology is diverse, that is 36.5% people with altered sensorium had a neurological challenge, 25.4% people had metabolic challenge, 14.3% people had multifactorial presentation. Ischemic stroke was the dominant neurological cause in almost 69.5% patients with high prevalence of posterior circulation involvement. With mortality rate of 36.5%, the study concludes that initial Glasgow Coma scale scores and the specific etiology, especially cardiovascular event, are more critical prognostic marker for the emergency room triage. The next original article is the surgical antimicrobial prophylaxis, that is SAP appropriateness and its impact on the surgical site infections. The authors, Dr. Yasjani Krupaya. Now, this study was conducted with the aim to assess the adherence to the surgical antimicrobial prophylaxis, that is SAP protocols, and its direct effect on the surgical site infections, that is SSI rates. This was a 6 months prospective cross-sectional study evaluating the time, choice of the antibiotic, duration of the prophylaxis against the institutional with implementation of the institutional as well as international guidelines. This study concludes that the data revealed a clear inverse relationship between the surgical antimicrobial prophylaxis adherence, which peaked at 83%, and the surgical site infection rates fell down to negligible 0.64%, suggesting that it is imperative to stick to the guideline-directed medical practices. The study concludes that the evidence-based antimicrobial stewardship is vital to sustain low infection rates and curb the antibiotic resistance. Sixth original article published in JAPI December 2025 issue is hand grip strength as a sarcopenia marker in the patients with cirrhosis of liver. And authors are Professor Dr. Shyam Sundar and team. Now, this study looked to determine the clinical utility of hand grip strength as a non-invasive functional marker for the assessment of sarcopenia in the Indian patients, those who have cirrhosis of liver. 100 cirrhotic patients were analyzed during this study using the handheld dynamometer, and the results were correlated with the clinical severity scores that is CTP and MELD, and the biochemical markers like albumin and INR. This study concludes that the hand grip strength declined drastically as the liver disease progressed, from 34 kgs in CTP class A to just 13 kgs in CTP class C. Hand grip strength showed a strong positive correlation with serum albumin and hemoglobin. The study concludes that the hand grip strength is highly practical, radiation-free bedside tool for assessment of muscle mass and frailty, especially in the patients, those who had cirrhosis of liver in the resource-limited settings. The seventh article, which is an original article, looks at serum uric acid and the left ventricular ejection fraction in the patients of heart failure. And the authors are Manvi, Sukhija, and Teep. Authors looked at serum uric acid and left ventricular ejection fraction with an aim to explore the correlation between serum uric acid and left ventricular ejection fraction in the patients with heart failure. So this is a cross-sectional study of 60 patients, primarily with the patients of heart failure with reduced ejection fraction, and those are 70%, whereas serum uric acid was measured and compared across the heart failure phenotypes. The study concludes that while hyperuricemia was prevalent, almost 40%, in the patients those who had left ventricular ejection fraction which was less than 60, but had a weak correlation when the patients were with the left ventricular failure with preserved ejection fraction, and was not statistically significant. So the study concludes that while serum uric acid is often evaluated in the patients of heart failure, it may not be a reliable biomarker for predicting the severity of the systolic function or dysfunction especially. Eighth study is the serum calcium as a marker of dengue severity, and the authors are Rajesh Deshwal and team. This study was conducted with the aim to evaluate predictive value of serum calcium levels in determining the clinical severity and the duration of the hospitalization in the dengue patients. The methods are a prospective observational study of 210 adult patients with established dengue were looked. Serum calcium was measured within 24 hours of the hospitalization and was correlated, and corrected albumin levels were also measured. This study concludes suggesting that hypocalcemia, that means serum calcium levels less than 8.5 milligrams per deciliter, was present in over 91% of severe dengue cases. Calcium levels negatively correlated with the hematocrit and hospitalization duration. The study concludes that the serum calcium is simple, cost-effective predictor for early triage, allowing clinicians to identify high-risk patients early. Next study looks at IAC, that is International Academy of Cytology, Yokohama system for breast lesions diagnosis. Authors are Zeba Jairajpuri and team. This study aims to evaluate and validate the diagnostic accuracy of International Academy of Cytology IAC Yokohama system for reporting the breast fine needle aspirates FNA. 450 FNA cases categorized using the Yokohama category benign, atypical, suspicious, malignant were included in the study and correlated with the histopathology. The study concludes that the system achieved a diagnostic accuracy of 98.57% with sensitivity of 100% with the IAC Yokohama system for reporting the fine needle aspirates. The study concludes that Yokohama system provides a high quality, reproducible reporting framework that significantly improves the communication between the pathologist and surgeon, reducing the diagnostic ambiguity. The last original article in December 2025 issue of JAPI is the magnetic resonance elastography, that is MRE, versus transient elastography in evaluation of the fatty liver disease. Authors are Prithi Shenon and team. This study aims to compare the diagnostic performance of magnetic resonance elastography (MRE) against transient elastography and traditional fibrosis score, that is FIB-4 score and APRI scores, in measuring the liver stiffness in the patients with fatty liver disease. The study involves 62 patients in the cross-sectional study with ultrasound confirmed fatty liver, and correlation analysis was performed between all 4 diagnostic modalities. The study concludes suggesting that the magnetic resonance imaging or magnetic resonance elastogram showed a strong positive correlation with the traditional transient elastogram for the liver stiffness measurement. While correlation with FIB-4 score and APRI were moderate to weak, the magnetic resonance elastogram proved to be robust and high precision tool for the diagnosis of fatty liver and the liver fibrosis and the stiffness. The study concludes that MRE is an excellent non-invasive alternative for staging of fibrosis in the patients with fatty liver disease. Now friends, let's quickly look at the review articles, and we are going to look at 3 review articles. First is Type 1 Diabetes in India, written by Dr. Manchi Sabu and team. They looked at the 3-decade reflection of post-DCCT. And the gist of this article is that India faces a unique burden of type 1 diabetes related morbidity as well as mortality due to delayed diagnosis. The authors call for the systemic reforms, including the National Type 1 Diabetes Registry, indigenous manufacturing of CGM or automated insulin device systems, and public-private partnership to improve the life expectancy of type 1 diabetics in India. Second, a review article looks at strengthening of the cardiac rehabilitation, and this is by Maria Prakash Jaindani and team. A narrative review looks at the cardiovascular disease management with a zest suggesting that the cardiac rehabilitation is severely underutilized in India. The authors conclude that leveraging telerehabilitation and community-based programs is essential to bridge the urban-rural divide as well as to improve the cardiac rehabilitation in a national public health priority. The third article, which is a review article by Dipali Taneja and team, looks at the machine learning and the artificial intelligence in ICCU. In an analysis of artificial intelligence versus traditional scoring, the Apache and SOFA standards were measured using the machine learning models, and they have found out that machine learning models can handle high dimensional EHR data more effectively in comparison with the traditional scoring systems. This review article concludes that while machine learning offers a superior predictive accuracy, we must address the ethical concerns and model transparency before full integration of artificial intelligence in the current SOFA and Apache scoring system. Lastly, friends, I would also request you to look at the pictorial CMEs and the communications, which would surely interest you. Thank you very much for listening to JAPI Podcast. I am Dr. Mangesh Tiwaskar, signing off. Thank you very much.